My name is Mike Stevens. I'm a consultant transplant surgeon. I'm based in the University Hospital of Wales in Cardiff. I've been a consultant surgeon here in Cardiff for the past 11 years, and I did some of my training here before that as well. So I've worked in and around Cardiff for the last 15 years or so. The day-to-day tasks of being a transplant surgeon are fairly varied. So maybe 5 or 10% of my week is actually physically operating. The rest of the time, it's about assessing patients, seeing if they're suitable to have a transplant, looking after them on the ward after they've been transplanted or in the outpatient clinic. Part of what I do is what we call a vascular access surgeon. So I make fistulas for patients before they have dialysis. So I see all patients, not just those who are suitable for transplantation. So I do see the whole breadth of our kidney population, if you like. When I'm assessing a patient's possible suitability to have a transplant, what we're really looking for is two things. The first thing is, are they fit enough to go through the operation? And the second thing is, are they fit and suitable to have the medication that we need to give you afterwards? There's a noticeable difference for me as a transplant surgeon calling in a home hemodialysis patient for a transplant than some of the other dialysis options. They tend to be much fitter, much healthier. So one of the problems, of course, of transplantation is that we don't have enough organs. So for most people, it means waiting for the suitable organ to become available. So the key for our patients who are on our transplant list is keeping well. And home hemodialysis really gives a good opportunity to do that. Those patients who have unit hemodialysis, so who are going to a dialysis centre 3 times a week, can keep very well as well, but it's a different treatment. If you're only delivering the treatment 3 times a week, you're packaging it all together into a bunch. So would I recommend home hemodialysis? Most definitely. If I had renal failure, I would be looking to get a transplant, but if I didn't have an immediate option of a transplant, I would choose home hemodialysis whilst I wait for an organ to become available. And there are a number of patients who aren't suitable for transplantation for one reason or another, and I would strongly recommend that all of them consider home hemodialysis as an option, explore it with their team, because it's a very, very good treatment. Patients who have home hemodialysis tend to be physically well. Their fluid levels tend to be normal when we start the operation, which makes a big difference. Psychologically, they're often in a better situation as well because they've tended to be having a more normal life. And that makes a big difference because it's a big thing to go through a transplant. Psychologically, it's a big thing. So if you're in a good place to begin with, then you're in the best position to be able to come through it. Home hemodialysis patients in general have the best opportunities for recovery after a transplant. In our speciality, we look after our patients for the long term. We see them developing through their lives. We see how much of a difference having a transplant makes to them. So that's probably the thing that I find most rewarding, really.